Good morning. I'm Dr. David Hagen of Hagen, Beyer, ENT and Sinus Clinic. Aubrey writes in, should antibiotics be used to treat ear infections? When, why, and why not? Antibiotics will work for most bacterial ear infections. Depending on the site of the ear infections, different types of antibiotics are needed. For bacterial inner ear infections, which are rather serious, you may need IV antibiotics and sometimes possible hospitalization. For middle ear infections, which most people commonly have with their children, oral antibiotics will usually suffice. And for outer ear infections or ear infections of the ear canal, topical antibiotics will usually do the job. Ear infections can also be caused by viruses as well as funguses. So it's not just always antibiotics as the main treatment source. A general rule of thumb is that you or your child is having ear pain or drainage which lasts over 2 to 3 days and is worsening, you should be seen by an ear, nose, and throat doctor to determine what's causing the ear infection and the appropriate treatment. Thank you very much.
Christy asks if her insurance will pay for her to have a nose job. Well, Christy, the long answer is that depends. A nose job, or what's termed in medical terms a rhinoplasty, is a surgery to change the shape of the nose. There's usually 2 reasons why someone's requesting that surgery. The first may be that the patient's just not satisfied with the appearance of their nose, and that's considered a cosmetic procedure. The second is the shape of the nose is causing nasal breathing problems, and that's a quality of life medical issue. With a detailed exam, we can determine if you have a deviated septum, do you have a deviated nose, and is that contributing to your breathing problem, and which type of problems you have with the appearance of your nose. Sometimes the surgery is performed for both reasons, and if that's the case, the insurance may very well pay for part of the surgery. But, of course, individual insurance plans vary, and we would have to make that determination for you.
Aaron calls in. He says that his wife complains he snores and it's bothering her, therefore it's bothering him. He wants to know what can be done about it. Snoring is caused by the vibration of excessive tissues in the throat. That can be the tonsils, soft palate. This vibration is caused by turbulent airflow as it goes through an obstructed area. So any form of obstruction in the nose or throat can cause vibrations of the soft tissues and therefore cause snoring. Constrictions can be a deviated septum, congested membranes of the nose and sinuses, enlarged tonsils, as well as flaccid soft palate and uvula. The treatment for snoring is addressing the underlying cause which is causing the restriction or the congestion. So treating the underlying allergies or some structural deviations within the sinuses can help. It's also important to differentiate between snoring and obstructive sleep apnea, which is a more serious medical problem, which encompasses not just snoring, but the cessation of breathing at night in between the snoring episodes. But if there's any questions, please see an ENT doctor to help differentiate between snoring and obstructive sleep apnea and helping alleviate the problem and therefore having a happy, healthy wife. Alex asks, hoarseness. I've been hoarse for a few days. Should I come in for an appointment? Hoarseness is sometimes a symptom of a serious problem such as thyroid or laryngeal cancer. And so it's a good rule of thumb that if you've been hoarse for over 3 weeks, you should be seen and evaluated and your vocal cords checked. Commonly though, hoarseness can be caused by allergies with drainage, upper respiratory tract infections, and sometimes even episodes of acid reflux. The key about this is the hoarseness should abate as the other symptoms of allergies, upper respiratory tract infections, or acid reflux clear. Again, a good general rule of thumb is that if you have hoarseness which persists over 3 weeks, you should get your vocal cords checked by an ear, nose, and throat doctor. It is always better to treat a problem when it's small than when it becomes unmanageable. Thank you very much.
Hi, this is Dr. Matt Beyer from Hagen, Beyer, Ear, Nose, and Throat Clinic. Today's question comes from Beth. She asks, what do I think about navage? Navage is a commercially available product used to irrigate the sinuses. Like other commercially available products, it's a safe and acceptable manner in order to cleanse and lubricate the sinuses. There are other products which are just as safe to use and are just different mechanisms in order to get the saline into the nasal cavity and into the sinuses. It's important to always remember to use distilled water when mixing saline at home and never use tap water. Thank you, Beth, for the question. We hope everybody stays safe and be healthy. Thank you.